Presenter is Yair Saperstein, and Yair is a co-founder and CEO of avoMD. Yair?
Thank you, and it's a pleasure to be here. So my name is Yair Saperstein, and I'll be presenting avoMD is the way to pronounce it, and we're the next generation of clinical decision support and pathways. I'll introduce myself a little bit in just a little bit, but what I wanted to do was to explain the problem that we're solving and what we're doing together with the AHA and with others in order to really provide information to the people that need it at the right time and give them the support in clinical decision making. So I don't know how many of you have read cover to cover the 99 pages of the most recent chest pain guideline. I have. And even for me to be able to apply that at the point of care when I'm with patients is something which is extremely difficult. And it's not just these chest pain guidelines. You know, this knowledge challenge, the fact that medical information is growing exponentially and is really inaccessible at the point of care is true for other guidelines too, and for other clinical scenarios. And this unfortunately contributes to substandard care, wasted healthcare spend, and medical errors. But what if we could just take the relevant parts of the guideline and have that available to the clinician for the patient at hand? That's exactly what we do. We make clinical evidence actionable by taking the clinical guidelines and transforming them into a point of care tool that makes the clinical evidence actionable for real practical use with patients at the point of care. Let me show you an example. So this is that 99-page chest pain guideline. Let me say that I'm an ER physician and I'm going to be assessing my patient. I'm going to be using now the mobile tool. This is also a web tool, can also integrate into the EHR, but for now I'm going to be using the mobile tool. Let me just type in chest pain over here to pull up the right one, chest pain evaluation and diagnosis. And let's say my patient has acute chest pain. So let's click on eval of acute chest pain. After my initial assessment, I assess the risk. Let's say they're intermediate risk. And so I get a little note that observation management is okay. They have no known CAD, so let me click on that. And now my patient has also no prior testing. So I'm going to click on no recent CCTA or stress test. And so I have my recommendation right here from the guidelines. CCTA or stress testing is the next step. Here's more details. Here's the level of evidence and the strength of recommendation. Let's say I do a CCTA and my results are obstructive. So now here's my next three options. Let's say it's high risk CAD. So I'm going to choose ICA for high risk CAD. And I have my final step in this pathway, which is invasive coronary angiography. Now, this is only one example, chest pain. We've done it also for atrial fibrillation, pre-op cardiac evaluation, anticoagulation, and it's limitless, the amount that we can do. You know, this is just for cardiology. It can even expand beyond cardiology. And so one question is, okay, that's great. I understand for individual clinicians, and by the way, for anybody watching it, if you want to be able to download it and use it for free, feel free to scan this. But let's say you say, okay, you know, more than an individual clinician, I'm thinking now as a hospital administrator, how do I customize this for my hospital? So we allow for this use either standalone or with EHR integration. And with EHR integration, you really can customize it to your own hospital workflows. You can generate notes and you can really have this as what is evidence proven to be the way of improving outcomes, which is by taking this clinical practice guideline and making it actionable at the point of care. This is not something which is just abstract. We do have a large number of customers and partners throughout the nation. And we also have strong ROI results from both clinical trials, randomized clinical trials that were done independently of us, as well as some of our implementations. We've been able to show that we can improve clinical accuracy and standardization. We've been able to show that we have efficiency gains when clinicians use our tool and save time. That we seamlessly integrate into the workflow, that we have a high clinician satisfaction score, and last but not least, we also offer CME credits for eligible content modules. I did promise that I would introduce myself a little bit more. So I am an MD and an MPH in internal medicine, affiliated with Mount Sinai, And this is actually my third company. My first two were nonprofit education based. And so for me, a lot of the motivation is how do I educate at the point of care while also improving care at the point of care? Junghum is a professional developer as well as a clinician. Lawrence is our COO, has an MBA from Columbia, and we have a very strong team within sales, content, and our overall product team. And so this is my last slide. If you want to try out the chest pain guidelines for yourself, as well as some of the others that we've put together, feel free to scan over here. This is all for free access. The distribution of these content is made possible by different industry sponsors. So the chest pain guidelines distribution was made possible by HeartFlow. Our industry sponsors do not take part in the content creation nor review. That's done independently. And so for the chest pain guidelines, for example, that was done by two of the guideline authors themselves. And so you can definitely feel free to use this. Feel free to reach out to me as well. If you have any interest in integrating this into your hospital or any further questions that I'm not able to answer now. And with that, I'll turn it back over to Heather for any questions.
Thank you so much. We do have a great question. People are really liking the ease that this platform seems to help consolidate the information out there. One of the questions is there a patient-facing portion to this that can help educate the patient in addition to the clinician who's making those clinical care path decisions?
Short answer is eventually. We're starting with clinicians and thinking it almost as a virtual clinical consultant that we're really empowering clinicians to do even better. Next step is going to be for patients. That's obviously a harder part. So it is within our roadmap, but not live yet.
Wonderful. Great. We have another question here that says, can you speak more about how we can integrate the chest pain CPG into our hospital? Does it generate notes, and can you customize the content?
Sure. So we offer any of this content to be able to be integrated into the workflow in your hospital. We are integrated with Epic and then have had discussions with other EHRs as well. So even if your system uses different EHRs, we should be able to work it out. It's integrated as a tab and it can produce a note. And the other question that you had was, can you customize it? So you can customize it. And so, you know, the AHA, ACC chest pain guideline is one example, is the way that's structured. But let's say there's CCTA versus stress testing, and one of them is not available. And so you would just include the one that is available within your hospital. So you can make those customizations as well.
Wonderful. Another comment, people are really liking this kind of concept of try before you buy with the free version. But could you speak a little bit more about the difference there for what they're trying, what they could eventually get, and how integrated this could be?
So the free version, there's, I forget the exact number now, maybe 7 or 8 that are freely available. For anything that is, again, made possible for distribution by our industry sponsors, then we then make that available as well to individual clinicians. For hospital subscriptions, those are, the enterprise subscriptions, those are paid. And that gives access to the ability to integrate into the EHR, the ability to see analytics on what the clinicians are using and then be able to correlate that to outcomes. The ability to use our builder tool, which is actually a no-code tool, which means that you don't need to know any programming language to use it. And so you can build in your own workflows and make them customized or new, as well as pull from any of our existing proprietary guidelines, which exist within the system, where, either from other academic institutions or other societies that were not, the distribution was not sponsored yet, to be able to pull those in as well. So you really have full access within the enterprise version.
Great. And that leads us to the next question, which I'm super curious about this because you read all the literature these days in all the industry publications, and you have COOs and CIOs of health systems just saying it's just not possible for health systems to move quickly to integrate new technology. How are you getting, or what's your best approach to some of the operations teams within the health systems that you also have to get to buy into this idea as the physicians love it? How do you get them to get on board and actually implement something like this and not take 2 years?
So our onboarding system is super simple. And so from a technological perspective and a technology side, we can do next day launch. But then the other side really is, how do you get the people to change? How do you do change management within the system? That's obviously a much harder question. And so usually you find the champion who is willing to help on the ground, or champions, and they're really able to help because the clinicians love it. And so once you can find that administrative support and champions, then you're really able to pull it off.
Great. And so if you had to give people one piece of advice for finding those champions, what would that be?
Look hard, seek out opportunities, and if you don't hit the right person, then just ask them who might be the right person.
Wonderful. Great. Well, I'm just going to give it one more minute here. It looks like the questions have slowed down. Any other questions for Yair? I really want to thank you for sharing your solution with us. It's just absolutely wonderful in order to kind of condense all of that information for us going forward so we can make good, clean decisions. And also really appreciate your insight into how to get the system to buy in and how to create those champions. Yeah, I'd encourage you to monitor the chat. We've got people posting even just comments as well. So it would be great for you to be able to chat with them as we move on to our next presentations. Thank you so much.